Hello, I'm Dr. Jacqueline Bezic. I'm a periodontist and a family dentist. I wanted to talk about some gum problems and give maybe some information that could be helpful, hopefully, for you. So, when we talk about gum issues, it can be as minor as gingivitis. Gingivitis term is for when the gum disease is just on the gum area, not extending to the bone. And this is something that anyone, any area of your mouth that you don't brush and floss and you don't clean, when the bacteria and stays, your body is responding to it by adding more blood vessels to fight and not let that bacteria to spread inside. So gingivitis causes that you would feel some bleeding of gum, some swelling, some maybe discomfort or not. So that could be just noticing that, oh, my gum is bleeding. Now, if that has not been addressed and it continues, then you will continue losing some support, because remember, your body is trying to fight and needs to bring more blood vessels and fighting cells, but unfortunately, like a negative cycle, to create housing for the fighting army coming in, your normal tissue is being destructed. And part of it is that you start losing bone. Then we call it pockets form, pocket like a pocket of your pants or what you have on your shirt. It becomes deeper, and that becomes a negative cycle more because you can't clean those deep areas. Now you try hard, you brush, floss, but you're not really reaching on those areas. That's when we call it periodontitis, which is meaning that the tissue supporting is destructed and affected by the infection. So all of these are infections, and the treatment can be varied from just simple cleaning for gingivitis to a deep cleaning for pockets that are formed. And if that has not been addressed and continues, you're going to have this continuing to the level that can cause tooth loss. I've had patients walking in with a tooth in their hand, and that can happen. Now, symptoms that I want you to watch is first, bleeding of the gum. It's not normal, it shouldn't be. If you are having bleeding, that area needs attention. Now, if it continues and becomes periodontitis, shifting of the teeth is one of the things patients normally notice more, because when you lose support, the tooth that was standing one location, now with the movement and forces, it kind of gets pushed away and you start seeing gaps form between your teeth. You might feel some sensitivity because the roots are exposed. The bad odor of the mouth, bad taste, or another that patients normally notice, and maybe not because they get used to it and they don't realize it. Maybe other family members tell them. So if you're having any of the symptoms, I like you to reach out to a professional, get to know where you're standing, and get treatment as soon as possible, because this problem is an infection that affects your health. The relationship of gum disease with diabetes, with heart conditions, with some, even every day we are learning more and more that having infection in your body is not a healthy thing to do, and you need to stop that. And if it was your hand and you would see that it's bleeding, you would reach out and put a Band-Aid at least on that. But if it's in your mouth and you're swallowing, you don't see it, doesn't mean it's okay. So please reach out if you have any of the signs and symptoms. And if you needed help and you don't have anyone else helping you, we'll be more than happy to help you. Our office is called MetroDental Health. We have 2 locations, Fairfax and DC, and our number is 202-363-5720 in DC, and Fairfax is 703-934-4474. If you needed to see us, looking forward to seeing you. If not, reach out to your dentist, and have a wonderful day.